are good to go. Good afternoon, good evening, and warm welcome to the Thought Leadership Panel proudly hosted by EthAum and Partners and Healthpro. This is Pankaj Gupta, Managing Partner at EthAum. We are a deep tech revenue scaler and fund based in Singapore with approximately 120 startups in our portfolio. Today, we are going to talk about how innovations and CSR grants are impacting, evolving the maternal, child, and elderly care space. Today, if you look at Asia's demographic, Asia stands at a pivotal crossroad. By 2050, over 1.2 billion people in the region will be 60 plus, while maternal and child health outcomes remain uneven across emerging markets. At the same time, innovative technologies and targeted funding mechanisms are creating unprecedented opportunities to deliver scalable, affordable, and high-quality care. Is it possible to create those kind of high-quality care solutions in the emerging markets? That's still a big question that needs to be solved and answered. As managing partner at EthAum and Partners, I have seen firsthand how health tech startups, when paired with smart capital, expertise, network, and execution-focused support, can transform care delivery across Asia Pacific. Healthpro is one of our portfolio startups from Indonesia, and it exemplifies how leveraging AI-powered workforce management to solve real operational challenges in hospital and home care can transform the space really well. Today, we bring together an exceptional panel of leaders who are driving this change from multiple different angles, from operations and elder care expertise to maternal child care expertise, health tech innovations, corporate social responsibilities, grants, insurance-backed funding, and strategic legal compliance framework. Now, before diving into the panel, I would request our esteemed panelists to introduce themselves, their background, to really understand how they will be adding insights and value to this conversation today. If I may start with Sunil. Sunil, could you please quickly introduce yourself?
Hi, everyone. I'm extremely glad to be part of this innovative session that we'd had. Maternal child care has been extremely important. Been working on this space for the last 7 years now, really trying to get the right solution out for mothers and really helping them how we can get better fetal health and outcomes. Before that, my larger journey has been more in the consumer tech space, being the CEO of a publicly listed company, literally looked at consumer and the impact of tech on businesses really getting reshaped, and probably seen almost like a 1000x journey over 15 years, really tech impacting the entire industry. I believe the maternal and child care space is really poised now for an inflection. It's the only journey from a longitudinal standpoint that becomes extremely important. And with AI coming in, it's really now the inflection point where literally you can personalize care for every mother. That's the vision that we're going with. And best of luck to all the other panelists as well, the kind of great work that they're putting in.
Thank you. Thanks a lot, Sunil. And I do understand that you come from consumer tech background. So you have had operational role, now entrepreneurial journey in the maternal and childcare space, which is quite exciting. So I'm sure that you are going to provide insights on multiple different perspectives.
Absolutely,
so thanks a lot for joining us today.
Yeah, more than happy.
Thank you. Pawan, may I request you to go next, please?
Yeah. Hello, everyone. I'm Pawan Soni, and I'm glad to be here with such enriched, experienced co-panelist. And I think I'm, as much as I can see, I'm the youngest one across all the panelists. But adding to my experience so far, it's been almost a decade that I'm working in the corporate social responsibility space. Work in the different thematic areas, which includes healthcare, livelihood, women empowerment, farmers, everything. But healthcare have been a very significant part of my portfolio put together. Now, from almost 4 years with Kotak Life, I'm working specifically in healthcare only, being in the life insurance industry, consciously chosen to be contributing for the India's health in the overall healthcare domain. And I'm looking forward to interact more with the co-panelists and will be happy to add value as much as where I can. Yeah.
Thank you. Thanks a lot, Pawan. Definitely younger from the age, but not from the experience insights perspective. I'm sure that we are going to learn a lot from your insurance and the rural maternal healthcare aspects of India. So thanks a lot for joining us today. I have Rendy on the call today, who is the founder and CEO of HealthPro. HealthPro is also the co-host of this session. Rendy, could you please quickly introduce yourself, and we can take it from there.
Yeah, thank you, Pankaj, for the intro. So hi everyone, my name is Rendy. I'm a CEO and founder of HealthPro. Glad to be in this event and also meet the strong role in maternity and maternal and elderly care in across a region. So my background actually is computer engineering, mostly in product, but this is my second health tech startup. My first, especially doing home care for elderly care and child care, but I graduate in that startup and then starting in agency startup and then join in a fintech. And then in 2022, I joined an Antler program in Indonesia and bring a Health Pro as an idea. So basically, with my experience and my background in tech combined with what happened in previous startup and want to bring more value here. That's why we create Health Pro. So mostly we focus in the healthcare worker side, but still to solve the main problem that happen. It's elderly and maternal or child care in Indonesia. And yeah, happy to sharing and also happy to get insight also from another panelist.
Thank you. Thanks a lot, Rendy. And while we may think that countries like Indonesia and India in Asia are very similar, but they're also very different. The kind of challenges and regulatory challenges, the social, cultural challenges that exist in both the countries could be very different. So I'm glad that you are joining us today because your experience from building the company in Indonesia and then expanding to Southeast Asia would be extremely valuable today. So thanks a lot, Rendy. In the next 45 to 50 minutes, we will explore how cutting-edge innovations and strategic grants are not only addressing today's care gaps, but powering sustainable growth across elderly, maternal, and child health sectors in Asia. So my first question is around innovations that are driving changes. And because we have Sunil and Rendy, who are the innovators, entrepreneurs in the panel, I would request Sunil to go first. So Sunil, we are seeing exciting tech-enabled solutions reshaping care delivery from AI-powered staffing, home care platform to allied health programs design, and also not only in the staffing and home care platform, but also in the rural India, in the emerging part of Asia, where a lot of interesting maternal and child care solutions are emerging. From your experience while building Oni, what innovations or operational models have proven most effective in Asia? And hopefully you'll be able to share some stories, not only from India, but also Southeast Asia and other Asian countries. Sunil, please.
Yeah, I think fundamental to maternal and child care, the biggest I think differentiates versus any other care is the longitudinal nature of data itself, right? So pregnancy is a continuous journey, right, where the mother is actually going through every minute, every second change. And that is where everybody needs to obviously take a lens, a different lens than any other physician, right? Majority of the care that you provide today is episodic and then obviously solves the solution. But in maternal and child care, it's continuum, which is what really differentiates one care vis-a-vis the other. And when you look at, let's assume, even at a mass level, at a macro level as well, I think one of the most very well implemented ecosystems is the Singapore ecosystem. Not only the fact that it is 100% compliant, but even there are strong guardrails being built in the physical ecosystem itself, which is actually making care delivery and hence the quality of care as well to not only get streamlined, but is very, very process driven. I think the implementation of a very strong system on the ground, both private and public, and there's a very strong participation between the two systems, right from the beginning, not only allows for better incidence of care, but also the quality and the standard of care that you get really provided to is far superior than any other of the ecosystems that we see, which is where I think that's just the foundational care ecosystem itself is far stronger than anything that you have anywhere else within from an Asia standpoint. Now, layer that with innovation. There are multiple layers of innovation that are get added, including fetal monitoring systems, etc., which is also now adding to the foundational power that has got built. For me, the way I look at it, you have a great foundation. Yes, the data sets are small. We all understand that. But the fact of the matter is well done, well executed, fairly solid. And on top of it, where innovation sits, it then adds so much more value, both from a care delivery for the mother as well as care provider perspective as well. When you look at ecosystems like DotoCare, they are really being able to get the right instances for great delivery at the right time. For me, that is the power of the ecosystem that actually exists, and the value is that they generate is tremendously higher.
So, Sunil, just extending my question on what you already shared. So data is a problem, right? Quality of the data and the training models on the data that you have. Do you see similar kind of problem statements in all other countries of Asia, or this is a very India-specific problem? What do you think on that?
See, when you look at a macro level, you're only covering 8 to 10 consultations in a 280-day journey. And which is what exactly that's the problem that we're trying to solve, which is basically saying 98% of the journey itself is not monitored. Now, that is outside and completely from a blue sky perspective. But when you look at the foundational layer itself, which is at least doing 10 to 12 consultations, when you look at it compared to, let's assume, India or even for that matter Indonesia, the numbers are as low as 4.
Right.
And literally the bigger problem is even in that 4, the problem is the incidence itself is very, very poor, right? So only 60% of mothers even have a first trimester screening done. And that is where the bigger problem actually starts. So you have such a huge population. And in that population, you're not even delivering the right timing, which is where the bigger problem at an ecosystem from scale and a multiplier effect of that scale comes into play. So I'm just leaving alone the innovation that we are working on. But outside that, the standard care delivery, when you look at it from a Singapore perspective, outside Singapore, the numbers are really, really dismal vis-a-vis what Singapore delivers. But which is where the public-private partnerships have to kind of go out and make it stronger. And I think the bigger problem is awareness, where I think somewhere pregnancy is always seen as a natural biological process which will take its own shape. And that, unfortunately, is not the case anymore, right? We all know that the health of the mother is poor, and it's not an Indian problem, right? It's a global problem. We are below, our fertility rates are below replacement. I'm like across the globe today, right? And it is where I think the understanding from a consumer standpoint itself, the awareness itself is missing. Yes, Singapore has obviously made a great ecosystem, but none of the other countries have been able to shape up and build up that kind of awareness that is required for the consumer to really know, saying, listen, I have to do a first trimester screening, and then I have to follow up and do my screenings at the right time. Now, these screenings obviously help benefit, right? I'm like, there are enough and more incidences where just by tracking blood pressure early in pregnancy, you've been able to reduce preterm births by 20%. I'm like, there's clinical studies done around that ecosystem. Now, what that significance from an Indian standpoint, where the country is now talking literally 1 out of 2 children being preterm births, is significant high in terms of volume. So it's about just getting the right education at a consumer level, which is important. Of course, we need an ecosystem which can then take that educated customer to go through better educated care and then follow it up with getting the right milestones and delivering the right milestones at the right time. So yes, it's an overall ecosystem rehaul per se, but like I said, to begin with, having at least a great foundational system itself is a starting point.
Interesting. So while awareness and education is a big bottleneck over here, I think in countries like Indonesia and others, education is the problem, but also the availability of the workforce to provide the right kind of diagnosis, treatment, and care to the patients. And I think this is where, Rendy, I would love you to share your insights on what are the challenges that you are seeing in Indonesia from the workforce availability perspective, and how you are solving that problem statement with your on-demand workforce solution. Rendy, please.
Yeah, thank you, Pankaj. So, I think I think it's not happened only in Indonesia. I think it's happened across the globe also. Indonesia is we are shortage of healthcare workers, but I think the problem is not about the shortage. The problem is they are not um, uh, utilized well in healthcare facility setting. So we cannot we can imagine that healthcare workers can directly to patient face by face, right? The healthcare facilities is the middleman to make sure that the transaction will be safe and so on. So this under not utilized well in Indonesia. So that's why HealthPro coming for this. So we are make sure that any type of healthcare facilities can get their healthcare workers ready anywhere and anytime, because we cannot imagine, we cannot hope that these healthcare facilities can hire all the healthcare workers in a full time, right? Because they have budget. Of course, they cannot rely on hire more healthcare workers to helping more patient, because patient come not in the fixed volume. Sometimes they're very high, sometimes it's very low. So in our innovation, we just make sure that the staffing process is faster, reliable, and in quality control. We create the supply, the fitted supply. The first one we doing the fitted supply. So we maintain the pool verified nurse, midwife, caregivers, doctors, any type of healthcare workers. We onboarding them in our database and make sure their schedule, their skill set, and grouping them based on that. So while demand come from healthcare facilities or any type of facilities, we matching that based on the request, based on the role, based on the shift, based on the urgency also. So let's say example, if the ICU room need healthcare workers immediately because the patient volume is higher immediate suddenly, and we will connect them with a bunch of healthcare ICU nurse that ready in that time. And then we because of that we fast the full thing, because we already fitted them in upfront. And after their deployment, we continuing to run the SOPs, use facilities feedback to make sure we can provide the better service in the future. And then after that, this is why innovation, how innovation or AI thing rapid all this, which with matchmaking process and also the forecasting, predict the future to anticipate earlier what happened. So the number it will be need to learn with the biggest data that we are create. But with this innovation, we just want to make sure not only hospital, clinic, nursing care, nursing home, maternal child care, or any type of healthcare facilities that need these healthcare workers ready most can get them immediately.
Fantastic. So it means that you have created Uber for healthcare workers, where hospitals can manage their operational cost by having the healthcare workers based on the demand. So they may not have to hire
Yes.
full-time employees, but they can request the healthcare workers when there's a demand, and if there's no demand, then they don't have to pay salaries for those non-utilized hours. And
Correct.
if you talk about the best or highest utilization of the healthcare workers, then probably that efficiency gain can be deployed not only in Indonesia but most of the other countries, even in India, where
Yeah.
hospitals may be facing really high cost, or they may be concerned about the
Yeah.
profitability or EBITDA. Fantastic. Thanks a lot, Rendy. And now I'll have to get feedback and insights from Pawan, because innovations alone cannot scale without the capital and enabling mechanism. And Pawan, since you have been looking at various NGOs, various projects in India, I would like to understand first, how do you evaluate merits of different healthcare or sustainability initiatives or different NGOs, and how do you really track where the funding is being utilized? What are the outcomes of the funding that you have already given to these initiatives, and so on and so forth? How does this process work for you, Pawan? Please.
Right. Great. So I think Rendy and Sunil has significantly added to the prior conversation very significantly. And this very topic itself is very interesting because of the two simultaneous demographic pressures which is happening in Asia right now. India, China, Japan, and all other countries in Asia are now becoming the aging uh, populations. A decade before, we used to be considered the youngest countries across the world, but now we are the most aging. We will be becoming the most aged countries across the world. So that is one thing. And the persistent gap uh, in the maternal health and the child health in a rural area specifically, where 70% plus population is still in the rural areas of these countries, right? So when it comes to filling the gap from the funding perspective or from identifying the significant healthcare program, there are very scrutinized process which are in place in the corporates, not only in the Kotak where I am associated with, but in the industry across. So first and foremost is the local presence of that particular NGO, because I can't ask a child or the mother, or for that matter elderly, to go all the way 100 kilometers away from his base location, because that's a direct or indirect compromise of his wages or the income. So that's the very first thing. So we do identify the NGOs and the people who are working locally and have the local presence and the ecosystem presence locally in any manner. Maybe it maybe the capex they have, maybe the infrastructure they have, maybe the connect with the community they have, so that community don't need to travel very long to get the treatment or get the accessibility of the healthcare system. Second, the pertinent problem of that particular area should be addressed by that NGO itself. So let's say NGO may be working in the livelihood, but the issue is related to the healthcare. The NGO is of no use. So thematic alignment is also very much necessary. So that is another evaluation parameter. Third, what corporates business value and the alignment is with. So I'll tell you the very good input that our board of directors gave as a philosophy for our CSR. So being in insurance, being in BFSI, we consciously chosen to work in healthcare while there was another areas available. So healthier the people in country, lesser the claims in insurance and higher the profits of the business. So that's how our whole management system thinks. So as much as we contribute to the healthcare system, is directly or indirectly getting pumped again into the business, and more profits than more CSR, and this cycle goes on and on and on. So we'll be able to contribute more through CSR once the business grows, and how much we are contributing to CSR is equally proportionality contributing to the profits again, right? So that's a very good cycle that most of the corporates are started adopting now. So that's another parameter. Fourth one is obviously the training and capacity building initiatives within the local community to ensure the sustainable initiative. Maybe 3 years down the line, 5 years down the line, I may not be continuing in the same location. I may not be continuing in the same thematic area, right? So how I can build the local capacity. Let's say, for example, if I'll talk specifically about healthcare, there's a complete government ecosystem which is available, starting from ASHA workers, ANMs, sub centers, public health centers, and government hospital over there. But mostly in the rural or the underprivileged, underserved sections, these ecosystems are not that strengthened to serve the complete requirement of that particular area. So I was fortunate enough to work in the Tata legacy with one of their companies. So they think very differently. So they want, actually, they believe in to be a catalyst in the CSR space, where even if investing my one single rupee can bring 10 rupees of the government ecosystem put together, which is most likely the cases in the government most of the time. If you'll see, they have the whole ecosystem in place, but the medicines are not coming on to time. So can I only support for the medicines? So the whole system will start functioning. There is a doctor available, there's a commute vehicle is available, but they do not have money to operate that vehicle. They don't have a money to run the vehicle or the ambulance on the ground. So can I give a petrol expenses so that whole machinery can function itself? So rather than identifying the complete cycle, sometimes you can focus on those elements also, right? And if I'll talk about some of the projects that I am doing, healthcare is also a very big space. Like you can't really fulfill being a one corporate or a group of corporates even. So you need to really identify your niche, which segment you want to work upon in the healthcare. So we consciously chosen to be in eye care space, where we are one of the element is retinopathy of premature babies. So obviously, if the baby is premature, there are high chances that eventually baby can go blind. So we are working on that particular niche segment also, where our intervention will be affecting rest of his or her life. So that becomes another identification element. What is the niche requirement of that particular area? What is the birth rate in that area? How many children getting birth every year, and how many of them are preterm? How many of them are like neonatals? How many of them are like not of adequate, not having adequate facility at their doorstep also. So that is another element. Now, from the accessibility perspective, sometimes even if having all these machinery in place, they can't reach to the last mile. So PSCs are also sometimes 5 kilometers, 10 kilometers, 12 kilometers away within the vicinity of the villages also. So then if we really want to make India healthier, we'll have to reach to the doorstep. Like we used to have the polio program in India, where the dedicated person used to go every door and knock whether your children has the polio dose or not. Right. Likewise, at our company, what we are doing is we are running a 14 mobile medical vans, which goes door to door to have a preliminary screening done. We call it OPD. So they identify the local problems, local healthcare related concerns of the family, and they either give the then and there treatment or refer to the nearby hospital for the secondary or the tertiary treatment put together. So these are a couple of factors which contribute significantly to channelize the funds in CSR, more or less. And we keep 10 to 15% open for the innovation experiment to do the new learnings here and there, which we can eventually replicate in the long-term project, let's say 3 years, 5 years down the line. So initial screening needs to be done, initial identification needs to be done, evaluation needs to be done. We follow our whole very long due diligence process. Sometimes NGOs are really pissed off with why we are asking too many of documents. But in India, regulatory guidelines are becoming heavier and heavier day by day, right? So we need to keep our paperwork also aligned with those regulatory bodies. So bearing with that, I think CSR is very much aligned with the India's challenges and the gaps, and it can be very instrumental, not only in healthcare but the overall development parameters of the India put together. Yeah.
It's interesting. I mean, it's from outside it may seem an easy role, but balancing all the regulatory frameworks, innovations, on-ground realities, on-ground challenges, and then creating something impactful is not really, a piece of cake. It requires a lot of, a lot of effort, a lot of, collaborations and so on and so forth. I think this is fantastic. And talking about collaboration, obviously innovations and grants have to work together to bring the real changes, real impacts in the society. And this is where I would love to get feedback from all of you. And I'll start with Sunil. So Sunil, from your perspective, have you seen the right methods where innovations and grants are working together in a very synergistic manner, creating the meaningful impact. If there are any success stories, any case studies that you have, how these two ecosystems have functioned well, then please feel free to share.
No, I think for me, the only limited experience regarding grants is a lot of these government grants, etc., through accelerators that you get. In fact, we were lucky to get a small amount even from IKP as part of the Amrit Grand Jan Care Challenge. And that's where we believe there is a huge opportunity for both the private and the public ecosystem to get together. Though we got a grant, it really helped us build the prototype, get it out and up and running. The implementation is still, something that we, really left wanted with. But the limited point I think I make is, and I think some of it, I'm just picking up some thoughts which Pawan mentioned. And I think it's very, very relevant that, we at a larger ecosystem level, there needs to be a concerted effort going across, like I think somewhere get Pawan and some, a bunch of guys like him who are putting in effort, I think at an individual level. And if there is a way, like I think what I limited know of is the Singapore government actually does that and encourages that. Get the public and the private, shareholders get together to have a much larger concerted and a more longitudinal impact versus really, so he's still investing into one entity for the next 3 to 5 years, has a much smaller view of what he's really solving for. But now imagine 20 of them getting together and all of them focusing in the same direction. The sum of that will definitely not be 20, it'll probably be a much larger multiplier. But what it also does is encourages far more and more people to look at success, and they would have more tangible success than they are currently able to put together. And I think another thing that Pankaj said, very, very important point that he made, right? If he's able to make impact right at the foundation of human birth, which is what we're exactly trying to achieve. Because that's where all human organs get formed. Pregnancy is the only window where development takes place. The rest of life, you're only maturing as from a maturity standpoint. And which is where the impact can actually be such a high, at a community level, be such a huge impact. Getting all of those resources together and a strong public-private partnership would actually take things to a completely new level. So there are individual concerted efforts being taken right now, but I think somewhere getting them together and putting them together like a fat pipe will have huge impact.
No, that's very true. In India, there are a lot of initiatives by the government to work with the innovative startups. Even in Singapore, the Singapore government has different initiatives running in parallel to support the healthcare initiatives or to support the innovation in general.
Yes.
So that's very true. Rendy, from your perspective, in Indonesia, what are those collaborative methods that are working really well between innovative startups and the grant funding organizations? And these funding organizations could be private, could be public, doesn't matter. Rendy, please. You're on mute, Rendy.
Yeah. So in my experience, especially in HealthPro, so the best model that we already done in the last 2 years is when the funding pays for the outcome and also tech scale the delivery. So in HealthPro we have currently we have two line of product. The first one, of course, on-demand healthcare workers, and the second one we call it CareBridge. So in CareBridge, we the CSR, the grant, or public or private partner can subsidize or even fully cover the home care base for underserved elderly and maternal or child patient. So the demand is already there. Especially in Indonesia, there are a lot of number of them. They are underprivileged and vulnerable patient in Indonesia. And then HealthPro's on demand, the tech is the execution layer. So because we already have the fitted healthcare workers ready in our database that there are already fitted, they have already run the standardized SOP, and also we can track the quality and also the result. So this work works well in the public or private partnership today, because we evolve how the grant will be used in the micro, even for a nano level. Even it will become evolved to insurance backed program, because in every dollars it can be tied to the clear metrics. So the response time, complete visit, patient outcome, and so on. The simple proof is in the last 2 years we are successfully convert the 200 total cumulative $200,000 donation grant CSR to more than 2,000 premium home care visit for the high need cases. We have elderly with stroke patient, diabetic wound care, cancer, and for childcare we have a cerebral palsy, stomach care, and also stunting. That is the biggest number in Indonesia. So it's not only the basic home care visit. It will be it already premium because it's with structural clinical follow up. Even we have a metric like daily functional, the ADL, Bertel index, and in some cases we can have metric also for avoid or reduce the re-hospitalization, because the care continued in at home consistently and safety. So with the measurable outcome or operation done with the support by tech and also by the fitted healthcare workers, so it will be blended to be best delivery to the CSR, to the grant, and also to make these healthcare workers have a more job and have a continued to have experience also in the patient level.
I see. So you have had first-hand experience where CSR grants of approximately 200K USD has been utilized to provide the right kind of care, home care, to different patients in Indonesia using the tech, using the innovation platforms that you have built, and obviously this grant is very much outcome driven, KPI metric driven.
Yeah.
I think Sunil and Pawan have also emphasized on the outcomes. If outcomes are not there, then obviously the public and private funding will not be available for these kind of initiatives. Pawan, I think you made a really interesting point that you are allocating approximately 10 to 15% of CSR funding on the innovation, which I think is quite high from the industry standard perspective, which means that you have had a couple of successes in the past where collaborating with the innovative companies or solutions have worked really well from your outcome-driven agenda perspective. So, Pawan, can you please talk about how you are partnering with these innovative solution providers? Couple of success stories, probably from your perspective, from Kotak Life's perspective, Pawan.
Right. So, if you see overall, every year India's overall CSR outlay is somewhere around 40,000 crores. Last year it was somewhere around 35-36 crores. It varies in the range, and it's really unfortunate to see hardly few hundred crores goes to the innovation. If you see the IITians which are working on some couple of projects, and as you rightly mentioned, since there's no immediate tangible outcome is there in any research and innovation, it requires a long-term investment. CSR professionals or the companies are little hesitant to invest on those kind of projects. We have kept it as an experiment to build the longer-term projects on that. That is our fundamental approach towards looking into any innovation or research-based project. We don't see it as a one-time project. Maybe we'll not support in continuity immediately after the year, But in the longer run, back of our mind, we have that thought process in place that eventually we will be having this project onboarded in 3 years, 5 years down the line horizon, right? So one of the very good case study, I'll rather say, where we became a indirect catalyst in that program. So there's one organization in Tamil Nadu, which they started working in this retinopathy of premature baby cases. They were working on a very nascent stage that time and with a very less funding available. And they really wanted to initiate the partnership with the government institutions. They were doing it, but on a very limited scale, with a very limited infrastructure capacity. So we say, okay, let's try this out. We doubled their capacity, what they were working upon. We gave them the capital requirement to have the specific equipments in place in like 2 years back. And luckily, last year they got supported by HCL Tech Grant for a larger funding. So when we were working with them, they were yearly doing hardly some few hundred children screening for this retinopathy of premature babies, right? But immediately in the HCL Tech Grant, the scalability becomes so high that they adopted 10,000 villages in South to do the 100% screening of all the newborn babies for this retinopathy premature baby identification.
And
So
sorry, how much time it took them from going from 100 children to 10,000
villages,
villages? Wow. How much time
two
did
to
it
three
take?
years, 2 to 3 years.
That's a pretty strong growth. Okay.
Yeah. So see, what happens is sometimes the investment or the support that you see is very minimalistic. It can lead to the very large scale impact with with the right organization and with the right intent. So that's become a very good case study for our portfolio put together. So that was a very like I will not say innovative because they were doing it something, but it was new for us to
Right.
learn and to be in that particular space. While I am being not from a healthcare background, particularly, or none of my team members from a healthcare background, but to just seeing it from the experimental perspective, see how it goes, see what comes out from that. Okay, let's try. Let's put at least 5, 8, 10% budget. Let's see what comes out. Will that work in a longer run? So having the right mindset is also required. Like your management, your thought leadership should align with that thought. Okay, if it's okay if there's no outcome, it's okay if there's nothing coming out immediately, it's okay if there's no tangible outcome immediately. So that's very important from that perspective. So that is one thing. Secondly, in my almost a decade journey in CSR and trajectory, I have worked with Tata Strategic and Tata Motors. uh, so they are very much aligned with the innovative approaches, where how they can grow the income of an individual, because directly the incomes also contribute to the healthcare segment very largely. If you have good income, you can afford to be in the good hospital, then eventually you can take care of your own self and your family put together. And it is a standard rule, whether you are working in the rural or urban, everybody wants to get treated in the better hospital if they can afford it, right? So how we can innovatively improve the income brackets so that they can access the more good healthcare facilities. That was also one of the innovative approaches that Tatas are working upon to increase the per capita income in the rural areas. So that is a indirect benefit that healthcare industry is getting if you have a higher capita income growth. So that is one part. Secondly, if in healthcare you see, I'd like to quote one of my flagship program rather in that segment. So last year, what we did is, so if you will see life insurance, it has grown significantly after COVID.
Right.
Before that, nobody used to take life insurance seriously in India specifically, as much as I know. Once this was life or death question, everybody started buying in life insurance industry grown significantly after that, and so do life insurance, Kotak Life also. And I got onboarded after that. So we were experimenting lots of healthcare initiative, what needs to be done, what we can't do, what we can do, or who will give the tangible outcomes, in which segment we should look after for the longer term. After all that learning, we designed this program called Mahadrishti. So Maha stands for scalability, and since the its first phase in Maharashtra, so we use that Maharashtra's Maha in that. So that's how we come up with the name Mahadrishti, and Drishti stands for eye care that we wanted to do.
Right.
So it's an end-to-end program which incorporates 5 core elements. One is you're creating a local healthcare facility in the eye care space. none of the person of a particular district should go out for any kind of eye care related facility to have. It should have available in within the district. That's a one core element. Secondly, it start or accommodate all age groups even after death. It starts from the premature babies, goes to the adolescents, then adult, then old age. We screen them 100%. So our target is to ensure the 100% screening facility available at the doorstep. Everything comes later, whether you need an eye drop, whether you need a spectacle, whether you need a cataract surgery, or it's a case of diabetic retinopathy, it's a case of retinopathy of premature baby, or you require a corneal transplant whatsoever, comes at the later stage. So we ensure the 100% screening facility. Then accordingly, we provide the treatment in-house. And then after death, we partnered with a very good organization who facilitates the eye donations as well. So we are not living even after the death. People who are willing to donate their eyes, they can contribute, right? So it covers every horizon of the life, starting from birth to death, even post-death, in the one single program, in an integrated formulation, where if anything related to eye care happens in that particular district, uh, Kotak Life has taken care of it by every means. And all the beneficiary, they don't need to pay any single rupee from their pocket, because even if they were paying earlier, it is a saving for them. Okay, at least for the eye, I don't need to made any out of pocket expense from myself. Yeah, so that is another very good case study you must be seeing on my LinkedIn and across the news in Maharashtra as well. So obviously, it was a very complicated project that got designed with 5 NGO partners, government machineries. We are using all government machineries to popularize this program, to mobilize, and our all 5 NGO partners are having a local presence by some other manner. So they knew the community over there. And I can share the name of that district also, Palghar. I don't know how many of you heard about that. It's very adjoining to Bombay, like almost 120 kilometers away, right? So we initiated that over there. So that's another very good case study. It's a very complicated program, but I would like to host you guys somewhere after this discussion, whenever you feel free to come down to that to have a look around. Yeah. So that is another part. So it's almost, so in funding, I see it's a very individual decision. Who has a decision authority and what kind of mindset he or she is having. Right? Sometimes that guy is innovation inclined, then money goes to the innovation. That guy is not innovation inclined, research inclined, want immediate outcome. Fortunately, my management is very much inclined towards it. Being a BFSI industry where the outcomes are expected the very next day. You do the sales today, you want a money in accounts tomorrow. I came from that kind of industry, but still they thought, okay, let's do the experiment. That's very surprising for me as also sometimes. Yes.
Yeah. So, I mean, obviously outcome is important, but now you're focusing on patient capital, powered by the support of government machinery, powered by support of your network that you have. And that's why these two initiatives have been able to be successful in different parts of the country, which is, I think, really fantastic. I think, again, as we talked about it earlier, these innovations, CSR grants, they have to work together, but then obviously the government support has to be there to make them successful. Now let's talk about the future, 5 to 10 years down the line. If you had a magic wand, what kind of one policy change or technology breakthrough or collaboration model would you like to sort of get as a magician to bring the right kind of impact into the elderly, maternal, childcare ecosystems of India? And I would start with Sunil. Sunil, you are the magician now, and you need to do your thing.
Yeah. No. Yeah, I'm like, we're already on it. Honestly, I still believe, the complexity of maternal childcare, lack of data, the need for longitudinal data, and it can only be solved by, two things. One is, of course, AI. And the second is, of course, a strong tracking through the ecosystem. Right. So, which is exactly the problem that we really already started building our solutions kind of up and running as well now. The big opportunity we believe is the fact that because data is fragmented, AI can actually help literally personalize care. which we already started, began the journey, obviously through strong guardrails. But over the next 1 to 2 years, we see this literally getting from a care standpoint, literally personalized for every mother. Because it's so imagine in OPD of an Afghani, and every mother is in a different week. Every mother requirements are very different. Even the guardrails that have been built are based on certain use cases, and today personalization just does not take place. Now imagine that is what AI can actually change for you. But it's not only just the care that AI can change for you, it will also change the care between two consultations. So today, almost 60% of complications actually come out not during the consultation, but outside the consultation. And that is what AI can actually do that for you, really can help build continuous monitoring right from the first go, right? So today, if Pawan's doing a great job in helping children having challenges in their vision, etc., we should get to a point over the next 10 years where literally the child of AI actually comes in, not only helping process the data for the Afghani, but also provide the right clinical pathway that both the Afghani and the mother can take to empower having strong clinical outcomes, both from a fetal as well as a labor perspective, which is where we vision the next 10 years to be not just about pregnancy care, but also start as early as, let's assume 6 months, 1 year before you, so what we call as preconception, and then the next 10 years of life. So you literally have a whole generational reset that you can do over the next 5 to 10 years, where every parent, whatever age, whatever, health, whatever complications can enter into, let me call it a reproductive window, right from preconception to pregnancy to delivering to the next 10 years, can actually reset good quality health for rest of life.
Very interesting. So essentially, AI is your magic that you would like to.
It is such a strong processing engine,
Yeah.
That can really reshape a lot of things. The biggest challenge, of course, today that we have is there's very limited data in pregnancy, which is what we're really trying to get the first layer of data to be built. Once you build the data, is then about really so much more that you can do, right? So today, if we are saying your incidence of care in India is 4 and even Singapore is at 10, you're really saying 98% plus mothers are not even getting tracked for a 288 journey. Right now, imagine you've gone through that journey, you've been able to do that. That's the kind of data that you sit on. Now, you know exactly when the mother has entered into the pregnancy, what health she's got into. You also know the output. You have a child with complications. With that kind of data, you can literally pre-program at preconception. You exactly can get the Afghani to help the couple understand, saying this is the medical journey that the couple can go through, correct, before you start the journey. Then inside the journey itself, you can really make massive impact. And then you still have another 10 years where development can reshape whatever we want to do going forward. But that's the power that the processing unit can give you. And it's all about how can we harness that and then take the entire industry to a completely new level.
Yep. Makes sense. No, thanks a lot, Sunil, for creating that magic through owning.
No, it's wild. I know it's wild. A lot of people find me crazy when I say this, but that's the kind of power that we have now. And this is what we can reshape. It is a completely new dimension that we can rebuild around.
Yep. Thank you, Sunil. Let me ask Rendy, what is one policy change or breakthrough innovation that Rendy you will expect?
But firstly, I strongly with Sunil. This is complex in a matter especially in Indonesia about maternity, elderly, even for child. In Indonesia, there are programs. Our president create a program to give a lunch for child to avoid stunting, but it's not really that simple. Of course, a good food can help the stunting, but not that instant. But that's something that I hope we can see together in 5 and 10 years is we can create a big game changers in this maternal child care, elderly care, or child care. Is we can shift from paying for activities to paying for measurable outcome.
Yeah.
So I just met my friend, co-founder, a founder of climate tech in Indonesia. So it similar happened with them. So why they can scale that solution so strong and large is because they can measure the carbon. So we can measure one trees can absorb carbon 25 kilogram per year. So that's number. I think imagine we can use that measurable to healthcare. So example, we can scale the care outcome of the measure, the report, and let's example for physiotherapists, while they're visit stroke patient, we can measure the percentage of the ADL, percentage of speech recovery, or the cerebral palsy patient. Yeah, I think it will be extreme. The doctor can say, hey, in the 3 months it will be from 10% to 15%, 50%. I think it's extreme, but imagine we can do that in support with AI and with Sunil mentioned. It will be can based on data. It can absorb with any in healthcare facilities, healthcare workers, shareholder can absorb the data, and then the policy side can reimburse, or the procurement model can reward from the outcome. So it's not based on visit. It is not based on how long conversation from a doctor with the patient, how long the treatment, but what is the real outcome. It can measure. Maybe it will be incremental, of course, to the let's example stroke patient to be they can move by they can be do by themselves. I think it will be need long time, but we can measure that. We can fund that based on that outcome. So the technology, the AI can help that to absorb, to help doctor to calculate that help hospital facilities to measure how much fund that they need, how much expenditure that will be used to one patient, not only based on the activity. So I think if we build the measurability from a day one, it will be the simply can earn trust, can have a good reimbursement also from health pro experience, because we can prove how we can help the stroke patient. We got trust by CSR, by grant, and so on, and we can scale.
Yeah, I think Sunil want to add a point here.
Yeah, I actually just wanted to take one point from where Rendy left it. With AI, you would have that data. AI is not the incremental measurement. Today, what we're really doing, in fact, there are enough and more countries giving literally every couple incentive to have a child. I'm like, we had, a state where, we were disincentivized. Now you have incentives to have a birth, but that still isn't working. What's really not working is because the impact is still incremental. And if you really want to have that incremental impact and also show the fact that you'll be able to make massive, literally exactly track it. See, it's a 9-month journey. It's not a 1-day journey. It's not one consultation that you go and you come back, or you go a second and you come back, and third and you come back. It's a whole process. And if you can really make that process through AI, which is where for me that measurability will come the minute you see, all the data being put together, the process is literally being run efficiently, and AI is an enabler. It's not a replacement on decision making. It's just the fact that today the Obgani can replicate care personalized just by looking at data summarized for her. And that is where we believe the opportunity actually comes in, where the processing capability then takes it to the next level.
No, thank you, Sunil and Rendy. So I do understand that you are obviously very much innovation friendly, AI friendly, and you want AI to enable a lot of interesting sort of breakthrough in the healthcare space. Pawan, do you think any policy change may create a huge impact? What kind of policy change or other kind of changes you would like to see in this industry?
Yes. First, I'd like to highlight the enthusiasm of Sunil put together about this AI thing. But believe me, Sunil, I have seen so much digital divide where accessibility of internet is also a challenge right now in the country. Forget about internet; it's a secondary. Electricity is a challenge. Internet comes very far. I'm still working in the villages where there's no regular electricity supply, right? So first, that digital divide has to be fulfilled with the gap funding, either from CSR or through the government. And Pankaj, I'm specifically believes in the more accurate execution rather than the policy change. So I believe that we have enough policies already in place, and the government is bringing every time new one, right? But more emphasis should be on the implementation of the existing one. And let me quote you the very one good example of the very good initiative of the government, which is Ayushman Bharat, to
Right.
ensure that everybody has the basic healthcare facility and accessibility up to 4 lakh rupees, right? Uh, but the execution of it is not at very good level right now. The limitation of the hospital accessibility, limitation of the hospital's availability put together is so limited that people end up paying from their own pockets, right? All those ecosystem of the existing healthcare infrastructures are not being linked with the existing policies, right? So if I have the power to do something on that, I'll first ensure the execution of the existing policies rather than making changes. All the policies are made for the good reason, with a good intent and to bring the good impact,
Yeah.
right? I see the challenges in the execution of those things on the ground to reach to the last mile person, right? To transfer the benefit with which intent the policy was made. And there's no limitation of the money also. Government funds like in thousands of crores while making this policy, and the funds are available, but that money is not reaching to the last mile. So technology is to bring the transparency in execution
Yeah.
rather than making the changes in the policy. I see it from that perspective. If there can be a technology which can ensure the Ayushman Bharat policies to be implemented to the last mile, that would something I would like to invest on. There's a
Fantastic.
one organization. Yeah, there's a one organization called, I would like to quote, Hak Darshak. I don't know whether you heard the name. They only work for the acceleration of the government schemes, no other funding. There are thousands plus schemes for every single individual in the government right now. If you are sitting at your home, you can earn the bare minimum income while sitting at your home. There are so many schemes around it based on your categorization, skilling, caste, and everything, and so everything, right? So that organization only work with the government schemes, no external money required, right? So something with the execution, I think we should focus on how technology can bring
Right.
or strengthen the execution on the ground to reach to the last mile. I see it from that perspective, rather than making the changes in the existing one.
Fantastic.
Yeah.
Fantastic, Pawan. No, so the mandate is clear. There's a lot of responsibility on the innovator's shoulders today. There's a lot of money available. There's the right intent from the government. There are a lot of right kind of policies that have been implemented for each and every citizen of the country. It's just how do we execute those policies? How do we deploy that money for the right execution, for the efficient execution? And technology has to come into the picture to create that perfect execution. No, I think it has been a fantastic conversation. Really appreciate your insights, Rendy, Pawan, and Sunil, again from different perspectives and different kind of insights. So that adds a lot to this conversation. And I think at EthAum we are completely committed to back interesting entrepreneurs and leaders who turn ideas into scalable reality. I think the message is very clear. The convergence of innovation and thoughtful funding is not just powering growth, it is actually building a more equitable, resilient care ecosystem for Asia's elderly, maternal and childcare ecosystems. Again, really appreciate your time today. Thanks a lot, all the panelists, for really interesting insights. I think we need to regroup again and see how we can collaborate, how we can support each other's initiatives. If Rendy can bring his learning, his initiatives from Indonesia, Malaysia to India to support the existing or existing initiatives in India, then I think that would be a fantastic initiative or partnership. Similarly, Sunil and Pawan, if you may wanna explore synergies in Indonesia and Malaysia, then I think there could be partnership opportunities there as well. But let's collaborate, let's support each other to create a more equitable healthcare ecosystem which serves all the citizens of Asia Pacific. Yeah. Thank you for your time today. Appreciate it.
Thank
Thank you.
Thank you so much.
Thank
Thank
you,
you,
everyone.
guys. Bye-bye.
Take care.
Thank
Bye.
you.